Thank you very much, sir. The director in absentia,
I think other interns will emulate this. This one what
assistant director,
other interns.
chief medical laboratory scientist, principal medical laboratory scientist, the senior medical laboratory scientist, the medical laboratory scientist is present, my great intern, and of the greatest Nigerian student, great! It gives me presenting on the topic from endemic to elimination, Egypt's journey to malaria-free status and its implications for global health. I am Idoko Meshach Ojonoma, and I was humbly supervised by MLS Idoko Meshach Ojonoma. I'll be guided by the following outlines. Malaria remains a significant global health challenge that is caused by the parasite Plasmodium species. It is transmitted through the bite of infected female Anopheles mosquitoes. While preventable and curable, it continues to exert a heavy burden, particularly in the tropical and subtropical regions. Some of these Plasmodium species that infect humans include the Plasmodium falciparum, which is most severe, the Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium nolensis. The symptoms of malaria include fever, chills, headache, muscle aches, fatigue, and nausea. This malaria can become complicated, leading to severe anemia, organ failure, and stages in the liver and the red blood cells in the human case. This chart shows us the life cycle of malaria parasites, which the mosquito, that's the female, an infected female Anopheles mosquito, when it takes its blood meal, it infects the sporozoids into the bloodstream of the susceptible host. This sporozoid moves to the liver cells, infect the liver cells, and begin to replicate and forming schizoids, which now build up more merozoids inside. And then it releases the merozoids into the bloodstream, beginning the erythrocytic circle, which the merozoids infect the red blood cells and begin to grow again into another erythrocytic schizoid stage, infecting more red blood cells, leading to the destruction of these red blood cells. Some of the merozoids develops into gametocytes, which when another Anopheles mosquito comes to take a blood meal, it picks up this gametocyte, the male and the female gametocyte, and into its gut. When it gets to the gut of the mosquito, the gametocyte fuses and it forms the ookinete, that's the zygote. From the zygote to the ookinete to the oocyst, and then releasing the sporozoids, and the circle continues. Can we go to the next slide? This plate shows a micrograph of Plasmodium falciparum under a thick blood film. We can see the ring form of this organism in the infected red blood cell. The next slide. This plate also shows us the different species of this Plasmodium. We can see the Plasmodium falciparum, how it looks like in the thick blood film, the Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. The next slide. In 2022, there were an estimated 249 million cases of malaria globally. That's to tell you the burden of this disease, resulting in approximately 608,000 deaths globally. This vast majority of this burden, around 94% cases and 95% death, occurs in the WHO African regions. Children under 5 years old suffer from this disease a lot. The changing climate is identified as a factor that can exacerbate malaria transmission. We can see presently the increase in temperature, rainfall, and humidity. All of these factors increase the transmission of this disease. For example, in 2022, there was a flood that happened in Pakistan that led to over 2 million additional malaria cases. The next slide. The development of anti-malaria drug resistance in the parasite and also insecticide resistance in mosquito poses a significant trend to control and eliminate this disease, which necessitates the development and deployment of new tools and strategies that will help us to combat this disease. Malaria and poverty are closely intertwined because we see that most countries that are endemic with this disease have low GDP. Malaria places an immense strain on public health systems. you can see that in most hospitals, about 30 to 50% of inpatient admission as a result of malaria, and then 50% of outpatient visits also. The next slide. This disease leads to substantial direct and indirect costs, including lost productivity due to illness. You find out that when you are ill with malaria, you may not be able to come to work, you may be tired, you may be sick, and you will not be able to come. So it leads to absenteeism, diminished job performance, and then it incurs significant costs, expenses at home to treat this particular disease. Repeated malaria infections also in children can lead to impaired physical and cognitive development, affecting educational attainment and long-term economic prospects. The presence of malaria can deter tourism. Most countries that are endemic, some other countries, citizens from other countries are scared to come to such endemic countries because they don't want to get infected with these mosquitoes. I can remember in time past when these colonial masters were coming into Nigeria, malaria was referred to as the white man's, this country, or the West African generally, was referred to as the white man's grave, because most of the time when they come, they get infected with this disease and it's very severe for them. The next slide. Malaria elimination is a critical public health goal with profound implications, seeing the burden that it has bring to the world. So eliminating it will bring us more good. And that's the reason why the World Health Organization recognizes countries that have been able to eliminate malaria over the years. So eliminating malaria brings multitude of benefits that includes saving lives and improving health outcomes, strengthening health system, boosting economic development, increased productivity, reduced healthcare costs, enhanced investment and tourism, poverty reduction, improving educational attainment, and so on and so forth. The next slide. The WHO certification of malaria elimination is the official recognition by the WHO that a country has successfully interrupted indigenous malaria transmission. And some of the benefits of this certification includes global recognition and prestige for that country, demonstrates sustainable health systems, it attracts investment and tourism to that country, it reinforces political commitment, it inspires other countries and facilitates cross-border collaboration. Egypt's journey to malaria-free status is a remarkable example for effective malaria control and elimination efforts with significant implications for global health. Malaria situation in Egypt before elimination effort. Let's go back memory lane. Malaria is as old as Egypt's civilization. Pharaohs of old have been infected by this same disease. Record has it that even Cleopatra slept under bed net because of this vector that transmitted malaria. In 1942, there was a spike that led to about 3 million cases due to World War II disruption and also Anopheles arabiensis invasion to that country. The dominant parasites include Plasmodium vivax and Plasmodium falciparum in Egypt. The main vectors is Anopheles ferencis, which transmits P. vivax, and then Anopheles argenti, it transmits the P. falciparum. The Fayum Depression, which is a large irrigated area southwest of Keros, was particularly conducive to malaria spread, and it remained a persistent focus of transmission. Even in later stages of control effort, there was still resurgence of this malaria, but before this thing was eliminated, the malaria in 1998, due to the effort that was put in by the country, which we would see subsequently. This figure shows us the picture of these different vectors that transmit malaria in Egypt: Anopheles arabiensis, Anopheles ferencis, and then Anopheles argentis. This is a picture of the Nile Delta, which was also a potential ground for malaria. It was a breeding ground for malaria at that time, and also the Fayum Depression in Egypt. The next slide. Now, Egypt's journey to malaria-free status, having seen that they were endemic, they began the journey to eliminate this disease. Following intensive control programs from the mid-20th century, the prevalence of malaria showed a steady decrease by 1990, regressing in most governorates in Egypt. Malaria cases in Egypt dropped dramatically from 3 million as we have it in the 1940s to nearly about 0 in 2001. This significant reduction marked the shift from control to elimination. Although Egypt had largely interrupted the local transmission by late 1990s, there was still a localized outbreak that came up in 2014 due to the construction of this Aswan Dam in the Aswan Governorate, leading to 1 case of Plasmodium falciparum, 23 cases of Plasmodium vivax. This brought about Egypt's robust surveillance. They demonstrated that robust surveillance, rapid response, and which include targeted spraying, distributed insecticide-treated nets, mosquitoes, treated mosquito nets to contain the outbreak. This was actually a critical test of their elimination preparedness, and their successful containment reinforced their commitment to maintaining malaria-free status. The next slide. This is a picture of the Aswan Dam, and this shows us when DDT was used for spray. The next slide. So let's look at some of the factors that contributed to Egypt's success in eliminating malaria in their country. The first we would look at is sustained political commitment and funding. We'll look at comprehensive vector control and environmental management, robust surveillance and rapid response, community engagement and cross-border collaboration, and then lastly we'll consider health system strengthening and accessibility. Sustained political commitment and funding was actually the driving force for this elimination to be possible. Political will and investment. John C. Maxwell has it that everything rises and falls on leadership. And it was because the leaders took it upon themselves, committed and dedicated to eliminate this from the country, and that's why they were able to succeed. There was a long-term vision that was consistent. Even with the change of government, it was still a committed effort to see that malaria is eliminated. So there was a mass domestic funding into this process. The next slide. Comprehensive vector control and environmental management was also one of the factors that was used to disrupt the transmission. We know that malaria is transmitted through a vector, which is the mosquito. So it was disrupted through early environmental actions like prohibiting rice. You know, Egypt is a very good ground for rice cultivation. So what they did was, during that period, they prohibited people from having cultivations close to their residence to reduce some of this breeding ground and then contact with the mosquitoes. Also, there was integrated vector management where larvicides were introduced into some of their water bodies, and then the use of larvivorous fish like the Gambiosa in water bodies to eat up the larva stage of mosquito. Also, model water flow instead of leaving them in different areas, causing this breeding ground. We can see the picture of the Gambiosa finis, which eats this larva stage of mosquito. So this will, in a way, disrupt the transmission of this disease. Robust surveillance and rapid response. Egypt was on the lookout. We would say they were like a watchdog, monitoring every area that would be a potential breeding ground for these organisms. So there was early detection, swift action. Wherever they noticed that there is a breeding ground, it was always responded to. There was prompt diagnosis and treatment. In Egypt, it was made free of charge. Malaria treatment, malaria diagnosis is free because it is an effort to eliminate it. They want to really eliminate it. The next slide. Community engagement and cross-border collaboration. There was community engagement and then partnership with other organizations, even international organizations, to ensure that this was eliminated. The next slide. Health systems were also strengthening to provide accessible health care for the citizens. The next slide. What are the implications for this of the Egypt success story for global health? We can see that Egypt's achievement of malaria-free status carry important implications, offering valuable lessons and hope for other endemic countries like our country, Nigeria. We can pick up these lessons from them, and that's why this topic was actually brought about. The next slide. It shows importance of tailoring intervention to local epidemiology and vector behavior rather than a one-size-fits-all approach. It underscores that robust, accessible healthcare infrastructure like diagnosis, treatment, trained personnel is foundational for the treatment of this disease. In conclusion, Egypt's remarkable journey from endemic malaria to certified elimination is far more than a national triumph. It serves as a powerful beacon of hope and a practical blueprint for global health. We've seen that success wasn't accidental, but the result of decades of unyielding political commitment and sustained investment, innovative adaptive strategies in vector control and environmental management. a robust health system underpinned by vigilant surveillance and rapid response, crucially, the active engagement of communities and unwavering cross-border collaboration. Egypt's experience underscores that malaria elimination is not just a distant dream, but an achievable reality even in our country, Nigeria. Even in regions with historical challenges like we have it. Their path highlights the indispensable value of strong practical healthcare, the power of intersectoral partnerships, and the critical need for vigilance against re-establishment. As we look towards a malaria-free world by 2030, as we have it as the SDG goal, Egypt's story reminds us that with collective resolve, strategic investment, and a commitment to core public health principles, we can truly turn the tide against one of humans' oldest scourges. Their success is a call to action for all nations still burdened by malaria, demonstrating that while the journey may be long, a future free from this disease is indeed within our grasp. These are my recommendations.